Hi, I'm Jeanne Wisniewski, and I'm a nutritional therapy practitioner. Thanks for joining me again today as we continue our discussion on Breast Cancer Awareness Month. Um, the last 3 weeks, we have been talking about breast cancer prevention, and today we're going to talk a little bit about breast cancer detection. So preventing would include eating well, exercising, getting enough sleep, and mitigating your stress. All of those things help prevent or lower your risk for breast cancer. Now we're going to look at some tests that can help detect breast cancer. So the first two tests are really just a measurement of things you're doing to help prevent breast cancer. And these are super easy, non-invasive, and one is a vitamin D3 test. Most regular physicals will now include this in your blood work. So simple blood test, you're looking at D3. So incredibly low levels of D3 are associated with an increased risk of breast cancer. So they did clinical trials, and women with 60 milligrams per milliliter, 60 or greater of vitamin D have an 82% chance, decreased chance of getting breast cancer versus women who have 20 milliliters per milligram of vitamin D3. So if you have low levels of vitamin D3, that doesn't mean you have breast cancer. It just means your risk for breast cancer is increased. So tests to help you look at ways you prevent breast cancer is a D3 test. And supplementing D3, particularly as we're going into these darker months. Here in Austin, it's been raining for like 2 months, and I know across the country we've had a lot of rain and cloudy weather. So D3 is something to consider first testing for, and if you're low, if you're below 60, consider supplementing and getting out in the sunlight. Sunlight's a great form of D3, but that's 30 minutes with no sunscreen to get the D3 from sunlight. Otherwise, I highly recommend supplementing with D3. Another really easy test that you can do that looks at your carotenoid level is a skin carotenoid scan. That is just putting your hand on a machine and you leave it there for about 60 seconds and you're looking for a skin carotenoid score of 50,000 or greater. The office that I work in at the Breast Cancer Center here in Austin with Dr. Owen Winsett, we have a skin carotenoid scanner, and you can come in for the month of October and have a free scan. You can mention this video and come in for the rest of the year for a free scan and look at your score. And again, a low skin carotenoid score doesn't mean you have breast cancer. It just means your risk for breast cancer increases. Ways to raise your skin carotenoid score are all the things we talked about. Eating carotenoid-rich, mostly vegetables, which is the dark orange, dark red, dark green, with a healthy form of fat, because carotenoids, like D3, are fat soluble, and you can't really absorb the carotenoids without a little bit of fat while you're eating those vegetables. If you're someone who doesn't eat vegetables, I would highly recommend supplementing to get your skin carotenoid score to 50,000 or greater. The other day in the office, I scanned one of Dr. Winsett's patients, and the highest skin carotenoid score I'd ever had the privilege of scanning was 141,000. So come in and check yours out. Mine's in the lower 50s, but just a fun way to see how you're doing and a way to prevent or lower your risk of breast cancer. Now, these next tests are tests that detect breast cancer. By getting these tests, these don't lower your risk. This is just a way to detect, to see, do you have breast cancer? And that's a mammogram, an ultrasound, thermography, and there is an iron blood test to look at. So let's just go through. None of these tests are without risk. All of them have their own form of risk. All of them have pros and cons. We're going to go through these, and this is for you to make an informed decision, for you to consider your own family history and risk. But I would encourage everyone to do one of these forms of detection at least once a year. Bare minimum, you need to be doing a self-exam monthly, looking for any changes, any lumps that you might feel, looking for anything that looks like orange peel, if the nipple starts to invert, all of these different things, self-exam, you can see a change and you see, you're only going to the doctor once a year. You see yourself and do those once a month about the same time in your cycle. So you're, comparing apples to apples, so to speak. These other detection methods, a mammogram, so the pros of a mammogram is standardized. So the way you are set in there, the way this machine works, it's standardized. So year to year, if you're going to the same place, you're comparing apples to apples. A mammogram is the only thing that can detect cancer that is smaller than 1 centimeter. So technically, this is the only method that would detect the DCIS, or the very small cancer that would be inside a milk duct. The problems with a mammogram is a mammogram cannot determine the difference between if what it's seeing is a cyst or a tumor. It can't detect if something is, a cyst is typically benign, a tumor could be or may not be. So a mammogram can't tell the difference between the two. A mammogram exposes you to a certain amount of radiation. A mammogram tends to have a high false positive rate, which can be incredibly stressful, which I've had with a mammogram. I've done all of these detection methods, by the way. And a mammogram uses compression, so 42 pounds of compression. If you have a tumor, it could technically cause that tumor to burst. All different things to consider. With a mammogram, if you choose to do a mammogram, I highly recommend a 3D mammogram. Most of the mammogram centers now use that. It is a much better way to see. Mammograms do not work well with women with dense breast. I have the dense breast. Younger women have a higher tendency to have dense breast. It just shows up white, higher to see. So all these different issues with a mammogram, a 3D mammogram, definitely you can see better with. Big arguments about how often, if you do choose to do a mammogram, every other year, every year, at 40, at 50, when do you start? Again, something for you to discuss with your doctor to consider your own family history and your own personal risk. Another detection method is an ultrasound. So the pros of an ultrasound: no radiation, no compression. It can tell the difference between a cyst and a tumor, and it's more comfortable. The downsides of a ultrasound: it will not detect DCIS, and it is not standardized. So it's very dependent upon your the person who does your ultrasound. And if they don't roll it all the way up into the armpit area, you could potentially miss a large size tumor. So that's the problem with an ultrasound. Also with an ultrasound, standard insurance typically will not cover an ultrasound without a mammogram. So now you're paying out of pocket and finding some place that will give you an ultrasound without your doctor or your insurance covering that. So just different things to consider. There are doctors here in Austin, including Dr. Winsett, who do have ultrasound machines who do that without a mammogram. So talk to different doctors, discuss with what your family history and your risk rate is, and consider an ultrasound. Thermogram. A thermogram, the way it works is it's looking for a heat signature. So this is a camera. None of these methods are comfortable. They're all awkward in their own way, but with a thermogram, you sit in a room, your arms cannot touch your sides. You got to keep your arms out for 15 minutes to allow your breast to come to room temperature, and it's looking for a heat signature. Cancer, because the cells in cancer divide so quickly, it requires a high amount of blood flow to supply those cells so that they can multiply so quickly. And that increases the heat in the area of a cancer tumor. So the heat signature on a tumor will be increased. When I had and my tumor is benign, but because I had dense breast, it did not show up on the mammogram. It did show up on the thermogram. Ultrasound, you saw it right away. So it can see tumor growth, benign or malignant. But the problem with thermograms is that it gives a high number of false positives. Just like a mammogram, it will give a high number of false positives that can make some people very nervous and stressed. And I'm hoping that technology continues to improve, but a method for you to be able to look at that does not have radiation, that does not have compression, so it doesn't have those side effects, but it can have the false positives. And you do need a incredibly trained technician to read that thermogram well. So just different things to consider. And then a blood test that most people haven't heard of, and again, I'll include all of these links and research, is this is Dr. Harry Eidener, and he looks at blood chemistry, and there's 3 iron markers to look at. And typically you're never going to see an increase in all 3. So depending on if you have iron overload, you have too much iron, you have too little iron, that some would be high, some would be low, or they'd all be medium. But when all 3 are high, and the 3 iron things we are looking at is serum iron levels elevated, percent transferrin saturation elevated, and your total iron binding capacity elevated, or an elevated TIBC. If all 3 of those are elevated, that is indicative of cancer, in particular breast cancer, and you need to then go have, if you just had that blood work done, you need to go get a screening test done. All of these methods have their pros and cons. You need to consider them, but I strongly encourage that at least once a year, that all of you, and myself included, would have some detection test done to look for if you have breast cancer. None of these prevent breast cancer, but if you do have breast cancer, early detection makes for the best outcome. Consider all these things, look at the different research, and I hope that this month of October has reminded you to take care of yourself, and particularly your breast health. Thanks for joining me, and I look forward to seeing you again next week.